Hello parents, good evening. This is Dr. Lalit Mittal from Giggles Clinic. So today I'll be discussing about the small video about food reactions and what are the different types of food reaction and which type of food reaction is important in autism. The reason for giving this video is because there is a lot of confusion about which type of food reactions and what type of food we should avoid in autism and why we should go for this food intolerance panel test. Now, the reason behind this, there are basically two types of food reactions. One is immune mediated, which is IgE mediated, and the other one we call it as non-immune mediated, which is IgG. Now, the IgE testing which is done, it is an allergen type of testing which we go for either casein or gluten. So that is not important because the problem in autism is not of an allergic reaction. The problem in autism is because of intolerance. And why this intolerance happen? It is because in most of the autistic kids, those who are intolerant to gluten and casein, there is a leaky gut. If the gut is normally, if it is like this, there is a gap between this in the intestines or the mucosa. So this results in the leakage of the breakdown products of gluten and casein. Now, what is gluten? Gluten is present in wheat. It is a type of protein, and casein is also another type of protein which is present in dairy products. So what happens in those children, those who have a leaky gut, the gap between the mucosa, the breakdown products of gluten, which is known as glutamorphin, and that of casein, which is known as casomorphin, leaks from this gut and goes into the brain, and there it binds to some specific type of receptors. As a result of it, causes behavioral changes, hyperactivity, restlessness. So these are the problems and variety of things. That is a different presentation. So as a result of this, there is a problem because of this gluten and casein. So the important thing is that we should go for a food intolerance test. Now, food intolerance test, here they go for an intolerance. They check the levels of the tolerance. Suppose if the normal tolerance level in the body is 30, so depending upon the level of intolerability, the child may have levels of 50, 70, 80, and as a result of that, depending upon the level and the severity of intolerance, we advise the child to reduce the amount of gluten or the amount of casein in the diet. Because see, a restricted diet or GFCF diet is not recommended unless and until a child is having intolerance to these gluten and casein. Because if we restrict the child from gluten and casein, his nutrition will be compromised, his calcium will be compromised. So as a result of this, important thing is that we always have to keep in mind that whenever we are putting the child on a GFCF diet, we also have to supplement the child with multivitamins like calcium or omega-3, depending upon the levels, depending upon the amount of intolerance the child is having. So supplementation is very, very important. It is not that we have to supplement every child with the medications. We only have to give the nutritional supplements only to those who are on a GFCF diet in order to compromise and in order to compensate for the deficiency of the products or the nutrients which they might have as a result of going on a restricted diet. So I hope this video will give a better idea about the type of food reactions in autism and which type of food testing we should go for before starting on a GFCF diet in autistic child. Thank you.